Welcome back to Daytime Ottawa here on Rogers TV. Well, we're going to talk about a serious issue today, and that issue is ADD. It is the most frequently diagnosed behavior disorder in North America, and there's no better person to speak to. She's one of our monthly experts here on the show. We love this. Welcome to the show. It's great to have you here.
Thanks for having me back.
This is something I think we've heard so much about over the last 10 years. Let's first of all talk about ADD. Describe to us what exactly it is.
Sure. In terms of medical diagnosis, there isn't any clinical lab work that can actually diagnose ADD. So it's based more on what you observe and behavior. There's 4 key characteristics. I'm sure you've seen that all in kids, but impulsivity, distractibility, inattentiveness, and then also potentially hyperactivity.
So, okay, I always get concerned when we talk about this or when I read about ADD because even myself as an adult, you definitely as an adult, kids, I mean, aren't we supposed to be forgetful at times and hyperactive?
Inattentive.
Exactly.
It's so confusing.
So that kind of leads us into the second set of criteria. One of them is that a person would have difficulty socializing between adults, their teachers, or in a work environment. They have poor, low self-esteem, and that also perhaps these characteristics have been there before they were age 7. They're occurring at multiple locations. And so those are some of the other criteria which everybody doesn't fit into.
So I was just going to say, so basically the first ones that you said, you could notice that, but it's the second ones, because I mean, problems socializing, this sort of thing, this is where it becomes different for us.
Exactly.
How many phases are there?
Well, basically there are 4 main characteristics that we look at in terms of diagnosis, and then there's subcategories. In terms of getting to ADD and looking at kind of the health connections, there's about 7 phases that are connected, which we've spoken of before, kind of starting with the nervous system. But something that's really interesting that's very common in these types of adults and children is high cortisol levels. So it's been recently researched, and a lot of these parents are coming to us and they're saying, you know, I have an infant and he or she's just not sleeping, you know, not taking their naps, not doing the morning nap or the afternoon nap.
Right.
We have to keep in mind that cortisol needs to come down in order for a person to get into a deep sleep. That's one of the first signs that cortisol is slightly elevated in that individual.
Why does it seem like it's becoming more common, ADD?
Yeah, well, there's many things that are connected to ADD that we don't completely understand, but one of the issues is this whole concept of not having enough human interaction. And a part of the aspect is these children are looking for increased attention. Some of their behavior is related to that. Others is related to a biochemical level, more food sensitivities, more things that they're coming in contact with the environment that are hyperstimulating. I know with my children, I can tell right away if they've had something with red dye in it. You know, I look at their behavior and I think, where's the packaging? You know, I look around and it is within 10 minutes
what
I
happens
notice
to
a
them?
change. Well, they just become very active. Their listening skills reduce. They want attention. Just all those things that are like ADD.
I think a lot of parents out there, and myself included, are worried that it often gets misdiagnosed. Is there any truth to that?
Yes, absolutely, because again, a lot of it is based on being having an observation versus a clinical diagnosis in terms of blood chemistry, etc.
Joelle, I'm not a parent, but if I was a parent, I'm sure that I would be weary, though, because it does seem to be diagnosed a lot. I'd be weary to necessarily put a child on medication quickly. Are there other things that we can think about instead of going to Ritalin or something?
Yeah, you're right. Ritalin is one of the most overprescribed medications, and is it always indicated? That's a big question mark. So some of the things that we look at is we certainly get into food sensitivities, we get into friendly bacteria, keeping a person's blood sugar really even, because a part of it is hypoglycemia. So when a person's blood sugar goes up, we have hyperactivity, and then when it goes down about an hour and a half later, we have, you know, complacent, inattentiveness, difficulties focusing. But what I find is really interesting that everybody can take away is behavior modification.
Right.
And you know, if we look at that, first of all, we can redirect the child's behavior. So if a person's poking all the time, you know.
She's always doing that to me, by the way.
Looking for attention. So we can say, you know, whenever you want to poke Derek, you know, you can redirect by using your voice. So that kind of thing is the first thing. The second thing is the 3 C's. And that's really clarity. You want to be very clear what your expectations are with the child or individual. So maybe if you're a teacher, write down on the blackboard, no poking, put your hand up if you have a question, simple things that kids can follow. And then calmness. A lot of parents who are working with children with ADD, because there's a genetic predisposition, also have ADD. So they can fly off the handle very quickly. So you might want to step away for a little while before you readdress the situation.
TL mentioned, of course, Ritalin. Are there natural remedies that are available that parents can use?
Yeah, 2 of my favorites. One of them is lycopodium. Lycopodium is club moss. Now, homeopathic remedies can be dispensed in different forms, in liquid or crystals. But basically, lycopodium is a remedy that we call the coward lion. So inside that individual feels fear of failure, feels insecure, but on the outside they're very boisterous and very loud. They want to take charge. These kids are very bossy. They want to take control of a situation. They often have digestive issues. So that's one remedy. The second remedy is a remedy called Veratrum album. And this is a plant called white hellebore. And I had a child walk into the office that fit this remedy like a T. And basically this child was super, super fidgety, couldn't sit still. And the mom said, won't even sit still for dinner. Can't even get her to sit. She's on the chair, on the floor, everywhere. Craves pickles, craves sour things, also has a very cold body temperature, but restlessness is one of the big things.
This is always a great conversation. It's really appreciated, and you can find out more information by visiting our website. Don't go away, we'll be right back.